A very good afternoon to all. My study is on effectiveness of ultrasound-guided platelet-rich plasma injection in comparison with standard conservative treatment on improving pain and function among the athlete with partial tear of anterior talofibular ligament of ankle, a randomized control trial. Ankle sprain is the most common injury in the world of sports. Among all the ligaments of ankle, anterior talofibular ligament is most commonly affected. It is often mismanaged and results into long-term sequelae like chronic instability, chronic pain, and there is 70% risk of re-injury. These are the MRI picture of the normal and partial tear of ATLF. Platelet-rich plasma is the superfluous concentration of the platelet in plasma. It has 3 to 8 times normal value of the platelets. Platelet contain more than 30 bioactive growth factors. It has beneficial effect on tissue healing by stimulating proliferation, differentiation, by increasing collagen synthesis, angiogenesis, regeneration, and it also helps in reducing inflammation. Standard conservative treatment include acute management followed by functional rehabilitation program, which include range of motion exercises, strengthening, endurance, balance, agility, and sports-related activities. And we have 3 phases. Why this study is conducted? Because this is the most common injury in sports. If it is not treated, partial tear can become full tear and it may lead to chronic instability. It could even end the career of an athlete. We want to reduce risk of re-injury and we want our athlete to allow faster return to their sports activities. What is new in our study? PRP injection was given under ultrasound guidance. We focus on MRI diagnosed partial ATLF tear. PRP was prepared by double spin method, and this is the first randomized control trial conducted in all over India. Aim and objective of my study is to determine the effectiveness of ultrasound-guided platelet-rich plasma injection in comparison with standard conservative treatment on improving pain and function among the athlete with partial ATLF tear of ankle. It is a randomized control trial conducted in my department for 18 months among the athlete in the age group 18 to 35 years with lateral ankle pain. The inclusion criteria are patient with MRI diagnosed partial ATLF tear with history of lateral ankle pain within 1 month duration among the age group 18 to 35 years. These are the exclusion criteria. A sample size of 48 was calculated using this formula. Patients were recruited from the OPT of my department. We used convenience type of sampling. Block randomization technique with a block size of 4 was used. After getting the informed consent, 48 patients were allocated into 2 groups, that is study group and control group. In the study group, patients received ultrasound-guided PRP injection followed by rehabilitation program. In group B, in control group, patients received the same rehabilitation program. It is a single-blinded study where assessors are blinded. These are the independent variables. Dependent variables include pain measured by visual analog scale, ankle function measured by foot and ankle disability index (FADI). These are the study tools which I have used in my study. Informed consent and ethics approval were taken. This is the picture of centrifuge machine and ultrasound machine of my department which I have used in my study. This is the flowchart of my study. So next I am showing how we prepare PRP by double spin method. We procure 2 ml of the PRP. So in this picture, I'm showing how we give the PRP under ultrasound guidance. So this is the ATLF attaching to the talus and fibula. This is a needle. The black hypoechoic area is the toned region of the ATLF. And under ultrasound guidance, we can see our PRP is getting injected in and around the toned region of the ATLF. So under ultrasound guidance, we make sure that our PRP is getting injected into the desired area. These are the exercise program which we follow in acute phase and subacute phase, maturation phase, and they have returned to sports. Data were entered and analyzed using IBM SPSS 21 version. P-value less than 0.05 was taken as statistically significant. This table showing comparison of baseline characteristics and outcome measures between the group. As we can see in all the baseline characteristics, there is no significant difference in baseline. Next table is showing within the group comparison of outcome measures in both the group. As we can see, in all the follow-up, there is significant improvement is seen in both BAS and FADI score. Next table is showing comparison of mean changes of the BAS and FADI score between the two groups from baseline to second 6, 12, and 24 weeks follow-up. As we can see, in the second 6 and 12 weeks follow-up, there is significant difference is seen and more improvement is seen in the PRP plus rehabilitation group. However, in 24 weeks, there is no significant difference is seen, but more improvement is seen in the PRP plus rehabilitation group. Our study shows that PRP injection causes a significant improvement in pain and ankle function in all the follow-ups. PRP injection reduces the pain intensity within short time. Therefore, rehabilitation program can be accelerated systematically with sooner returning to sports activities. Functional rehabilitation group also provided the same result, but it takes longer duration of time. Other studies shows the beneficial effect of the PRP in ATLF tear. Some of my limitations include smaller sample size, short-term follow-up. To conclude, addition of the PRP injection in standard rehabilitation program has better improvement in pain and function in athletes with partial ATLF tear. Injection under ultrasound guidance probably gives additional advantage of giving intralesional PRP. This combination of treatment might be a treatment of choice for partial tear of ATLF, leading to early return to sports, preventing chronic instability, and reducing risk of re-injury. These are my references. Thank you very much.